The prostate is a small, walnut-shaped gland in the pelvis of men. It's located next to the bladder and can be examined by getting a digital rectal exam. Prostate cancer is a form of cancer that develops in the prostate gland. It's the second leading cause of cancer deaths for men in the United States. About 1 in 9 men will be diagnosed with prostate cancer in their lifetime. This year, nearly 191,000 men will be diagnosed with prostate cancer. Growths in the prostate can be benign or malignant. Benign growths like benign prostatic hypertrophy are rarely a threat to life and don't invade the tissues around them and don't spread to other parts of the body. Malignant growths may sometimes be a threat to life, and they can spread to nearby organs and tissues and can spread or metastasize to other parts of the body like lymph nodes or the bone. And often they can be removed, but sometimes they grow back. Prostate cancer cells can spread by breaking away from a prostate tumor. They can travel through blood vessels or lymph nodes to reach other parts of the body. After spreading, cancer cells may attach to other tissues and grow to form new tumors, causing damage where they land. When prostate cancer spreads from its original place to another part of the body, the new tumor has the same kind of abnormal cells and the same name as the primary or original tumor. For example, if prostate cancer spreads to the bones, the cancer cells in the bones are actually prostate cancer cells. The disease is metastatic prostate cancer, not bone cancer. For that reason, it's treated as prostate cancer in the bone. Now, in its early stages, prostate cancer often has no symptoms. When symptoms do occur, they can be like those of an enlarged prostate or BPH. Prostate cancer can also cause symptoms unrelated to BPH. If you have urinary problems, talk to your urologist or healthcare provider about them. Symptoms of prostate cancer can be a dull pain in the lower pelvic area, frequent urinating, trouble urinating, pain, burning, or weak urinary flow, blood in the urine, painful ejaculation, pain in the lower back, hips, or upper thighs, a loss of appetite, an unexplained loss of weight, or bone pain. Now, no one knows why or how prostate cancer starts. Autopsy studies show that 1 in 3 men over the age of 50 have some cancer cells in the prostate. 8 out of 10 autopsy cancers found are small, with tumors that are not harmful. Even though there's no known reason for prostate cancer, there are many risks associated with the disease. First of all, age. As men age, their risk of getting prostate cancer goes up. It is rarely found in men younger than age 40. Damage to the genetic material of prostate cells is more likely for men over the age of 55. Damaged or abnormal prostate cells can begin to grow out of control and form tumors. Age is a well-known risk factor for prostate cancer, but smoking and being overweight are more closely linked with dying from prostate cancer. Now, African Americans have by far the highest incidence of disease. 1 in 6 African American men will get prostate cancer. African American men are more likely to get prostate cancer at an earlier age. They are also more likely to have aggressive tumors that grow quickly, spread, and cause death. That reason why prostate cancer is more prevalent in African American men is unclear, yet it may be due to socioeconomic, environmental, diet, or other factors. Other ethnicities like Hispanic or Asian men are less likely to get prostate cancer. Men with a family history of prostate cancer also face a higher risk of developing the disease. A man is 2 to 3 times more likely to get prostate cancer if his father or brother had it. This risk increases with the number of relatives diagnosed with prostate cancer. The age when a close relative was diagnosed is also an important factor. Studies show that prostate cancer risk may double for heavy smokers. Smoking is also linked to a higher risk of dying from prostate cancer. However, within 10 years of quitting, your risk for prostate cancer goes down to that of non-smokers the same age. Prostate cancer numbers and death vary around the world, but are higher in North America and Northern Europe. Higher rates may be due to better or more screening procedures, heredity, poor diet, lack of exercise habits, and environmental exposures. Diet and lifestyle may also affect the risk of prostate cancer. It isn't exactly clear how. Your risk may be higher if you eat more calories, animal fats, refined sugar, and not enough fruits and vegetables. Lack of exercise is also linked to poor outcomes. Obesity is known to increase a man's risk of dying from prostate cancer. One way to decrease your risk is to lose weight and to keep it off. Can prostate cancer be prevented? Doing things that are heart healthy will also keep your prostate healthy. Eating right, exercising, watching your weight, and not smoking can be good for your health and help you avoid prostate cancer. Some healthcare providers believe drugs like finasteride, also known as Proscar, and dutasteride, also known as Avodart, can prevent prostate cancer. Others believe they only slow the development of prostate cancer. Studies do show that men taking these drugs are less likely to be diagnosed with prostate cancer. Still, it is not clear if these drugs are effective, so you should talk to your doctor about the possible side effects. Screening for prostate cancer means testing for a disease even if you have no symptoms. The PSA, or prostate-specific antigen blood test, and digital rectal examination are two tests that are used to screen for prostate cancer. Both are used to detect prostate cancer early. However, these results are not perfect. Abnormal results with either test may be due to benign prostatic enlargement or infection rather than cancer. The two main types of screenings are the PSA antigen blood test, which is one way to screen for prostate cancer. The blood test measures the level of PSA in the blood. PSA is a protein made only by the prostate and prostate cancer. This test can be done in a lab, hospital, or healthcare provider's office. Very little PSA is found in the blood of a man with a healthy prostate. A low PSA is a sign of prostate health. A rapid rise in PSA may be a sign that something is wrong. Prostate cancer is the most serious cause of a high PSA result. Another reason for a high PSA can be benign enlargement of the prostate. Prostatitis, or inflammation of the prostate, can also cause high PSA results. A rise in PSA level does not tell us the type of cancer cells present. The rise tells us that cancer may be present. Talk to your healthcare provider about whether a PSA test was useful for you. If you decide to get tested, be sure to talk about changes in your PSA level with your provider. Make sure to watch our video on the PSA blood test. The digital rectal examination helps your doctor find prostate problems. For this exam, the healthcare provider puts a lubricated gloved finger into the rectum. The man either bends over or lies curled on the side on this table. During this test, the doctor feels for an abnormal shape or thickness of the prostate. The DRE is safe and easy to do, but the DRE cannot by itself detect early cancer. It should be done with a PSA test. Now, in terms of who should get screened, screening is recommended if you're a man between the ages of 55 and 69, if you're African American, or you have a family history of prostate cancer. The PSA test and the digital rectal exam are very important tools. They help to find prostate cancer early, before it spreads, because when it's found early, it can be treated early, which helps stop or slow the spread of cancer. This is likely to help some men live longer. A risk of a PSA test is that it may miss detecting cancer, a false negative, or the test may be false positive, suggesting that something is wrong when you're actually healthy. A false positive result may lead to a biopsy that isn't needed. The test might also detect very slow-growing cancer that will never cause problems if left untreated. Now, in order to detect prostate cancer, you need a tissue sample, and you get a tissue sample from a biopsy. So a biopsy is a type of a minor procedure. For a prostate biopsy, tiny pieces of tissue are removed from the prostate and looked at under the microscope. The pathologist is the doctor who will look carefully at the tissue sample to look for cancer cells. This is the only way to know for sure if you have prostate cancer. The decision to have a biopsy is based on PSA and DRE results. Your doctor will also consider your family history of prostate cancer, ethnicity, biopsy history, and other health factors. I also prefer to use a prostate MRI to detect and localize prostate cancer and to perform an MRI-guided localized prostate biopsy. The prostate biopsy is usually done using an ultrasound probe to look at the prostate gland and guide the biopsy. You may be giving an enema and antibiotics to prevent infection from the biopsy. For the test, you will lie on your side as the probe goes into the rectum. First, your provider takes pictures of the prostate using an ultrasound. Your healthcare provider will note the prostate's gland size, shape, and any abnormalities. He or she will also look for shadows which might signal cancer. Not all prostate cancers can be seen, and not all shadows are cancer. The prostate gland is then numbed or anesthetized with a needle passed through the probe. Then the provider removes very small pieces of your prostate using a biopsy device. The amount of tissue removed depends on the size of the gland, PSA results, and past biopsies. If cancer cells are found, the pathologist will assign a Gleason score, which helps to determine the severity risk of the disease. After a biopsy, you may have blood in your ejaculate, urine, and stool. This should go away within a week. How is prostate cancer graded and staged? Grading, using the Gleason score, and staging defines the progress of cancer and whether it is spread. When prostate cancer cells are found in tissue from the core biopsies, the pathologist grades it. The grade is a measure of how quickly the cells are likely to grow and spread, or how aggressive it is. The most common grading system is called the Gleason grading system. With this system, each tissue piece is given a grade between 3 and 5. In the past, we assigned scores of 1 and 2. A grade of less than 3 means the tissue is close to normal. A grade of 3 suggests a slow-growing tumor. A grade of 5 indicates a highly aggressive, high-risk form of prostate cancer. The Gleason system then develops a score by combining the two most common grades found in biopsy samples. For example, a score of grades 3 plus 3 equals 6 suggests a slow-growing cancer. The highest score of grades 5 plus 5 equals 10 means the cancer is present and extremely aggressive. The Gleason score will help your doctor understand if the cancer is a low, intermediate, or high-risk disease. Generally, Gleason scores of 6 are treated as low-risk cancers. Gleason scores of 7 are treated as intermediate and mid-level cancers, and Gleason scores of 8 and above are treated as high-risk cancers. If you are diagnosed with prostate cancer, ask about your Gleason score and how it impacts your treatment decision. Tumor stage is also measured. Staging describes where the cancer is within the prostate, how extensive it is, and if it is spread to other parts of the body. One can have low-stage cancer that is very high risk. Staging the cancer is done by digital rectal exam and special imaging studies. The system used for tumor staging is called the TNM system. TNM stands for tumor, nodes, and metastases. The T stage is found by digital rectal exam and other imaging tests such as ultrasound, CT scan, MRI, and bone scan. The imaging tests show if and where cancer has spread, for example, to lymph nodes or to bone. These staging imaging tests are generally done for men with a Gleason grade of 7 or higher and a PSA higher than 10. Sometimes follow-up images are needed to evaluate changes seen on the bone scan. Now, not all men need imaging tests. Your urologist may recommend imaging exams based on results from other tests. But prostate cancer may spread from the prostate into other tissues. It may spread to nearby seminal vesicles, the bladder, or further to the lymph nodes and the bones. Rarely it spread to the lungs or other organs. Your healthcare provider may recommend a pelvic CT scan or an MRI scan or a bone scan to check if your cancer has spread. What are the survival rates for prostate cancer? Many men with prostate cancer will not die from it. They will likely die from other causes. For men who are diagnosed, it is better if it is caught early. Survival rates for men with prostate cancer have increased over the years thanks to better screening and treatment options. Today, 99% of men with prostate cancer will live for at least 5 years after diagnosis. Many men having treatment are cured. Most prostate cancer is slow growing and takes many years to progress. 1 out of 3 men will survive after 5 years, even if the cancer has spread to other parts of the body. Let's talk about the treatment of prostate cancer. Now, some cancers grow so slowly that treatment may not be needed at all. Others grow fast and are life-threatening, so treatment is usually necessary. Deciding what treatment you should get can be complex. Talk with your urologist about your options. Your treatment plan will depend on the stage and grade of the cancer, your risk category, whether your cancer is low, intermediate, or high risk, your age and health, your preferences with respect to side effects, including urinary incontinence and erectile dysfunction, long-term effects, and treatment goals. And results from other diagnostic tests will help your provider understand if the cancer can spread or return after treatment. Before you decide what to do, you should consider how immediate and long-term side effects from treatment will affect your life and what you're willing to tolerate. Also, you should consider what you may try different over time. If you have time before you start treatment, consider your range of options. Get a second opinion from different prostate cancer experts. You may need to see another urologist, oncologist, or radiation oncologist. Consider the expertise of your doctor before you begin. With more experienced surgeons, the risk of permanent side effects like incontinence and erectile dysfunction is lower. Also, it helps to talk with other survivors and learn from their experiences. In addition, try and get or stay healthy. Eating a well-balanced diet, maintaining a healthy weight, exercising, and not smoking are all important factors when fighting prostate cancer. This is Dr. Judson Brandeis, urologist and Hive 80 member. Thank you for your attention. Tune back in to Hive 80 for continual medical and wellness information. Wishing you the best of health.